From that, Dr. Sand says, well, how can patients participate if they can't see what I see? At our hospital, I can see every word he writes in the computer about me. And they're starting to do it for oncology and orthopedics and everything. I can actually see all of the doctor's notes about me. Sometimes I find mistakes. One x-ray report said I was a woman. And there were other things that were just plain wrong. In my mother's case, this is so important. Did you know that most medical records contain a mistake? At least one mistake, often many. When my mother had a hip replacement a few years ago, she was transferred from the hospital to a rehabilitation place. And somehow, when her medical records came across, her thyroid condition came over wrong. She is hyperthyroid, and it came across as hypo. And the important thing here is mistakes like this are not just a problem for the family. The best doctors and nurses in the world cannot do their job right if the chart is wrong. So what happened in this case? I have two very empowered sisters, and they said, could we see the chart? And the rehabilitation place said yes, and they found the mistake and fixed it before there was any problem. So there, ladies and gentlemen, there is an empowered, engaged family improving the quality of health care and helping the doctors and nurses do a better job. Well, here's one last example before we bring it to a close and start talking. People say, doctors often say, patients, stay off the internet. There's garbage on the internet. I don't have time for that. And then they complain that the patients are not engaged in their health care. Well, people go Googling because they want to know more. They may not be good at it, but the same as with a child who's learning how to do something. Do you say, stop that? Or do you teach them how to get better at it? The modern approach is if somebody's doing something that you'd like them to be good at, you teach them how to get better.